Commissioners. Please join me to stand and say the Pledge of Allegiance. I pledge allegiance to the flag of the United States, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Before proceeding, I want to spend a couple minutes to remember a very important county employee who died this past weekend. On Sunday, our law librarian, Mary Freiberg, passed away. Mary was just such a great role model for all of us, a great county employee. She worked hard. Her heart was always with and in service to our residents and the people who needed the services of the county. County Administrator Leslie Vermillion has a few words to say about Mary.
Thank you, Madam Chair. Yeah, I think Mary touched everybody that she worked with, from our residents to our staff. If you ordered a library book, that's who you interacted with when you went to pick it up. And she was really, really special. Just saw her a few weeks ago sitting there at 6 o'clock at night when I was leaving with some attorneys that were doing some work for residents who come in after hours for their services. And she was just tremendous. She worked here from 1988 till actually Sunday. About 27 years of service. She was gone for a couple years in there. In 1990, she was in the American Library's magazine for performing the Heimlich to rescue a 4-year-old who was choking on a piece of gum at the Shakopee Library. In the late 90s, she was ahead of her time. She coordinated the libraries to go, which became a precursor to the Readmobile. In 2009, she received a Meritorious Service Award for Excellence in Customer Service. In 2012, she received a Meritorious Service Award for Excellence in Collaboration and the Amicus Curiae Friend of the Court Award from Minnesota's First Judicial District. This recognition was for bankruptcy, divorce, and foreclosure clinics that she developed as outreach to our Spanish speakers. When we asked about her Spirit of Scott Awards, ER just told us it was too numerous to even count. I think it's fitting. Sometimes, quite often, I've gone to people's reviews to find out who they really are. They attach what they think they've accomplished or what their supervisors think they've done over the years. And Jake provided me with something that he thought was pretty fitting for Mary to have the last word. She's gotten a lot of accolades from a lot of people in the county and outside of the county. But when you hear her and her passion for serving the people that came in to see her, this is what she had to say when asked about what she loved about her job. I enjoy working one-on-one with law library customers. Most people come in here very anxious. I feel that if they leave with the resources they need to proceed with whatever court-related activity they have, that we have succeeded in giving them what they need. And I think that's what she came to work with. Deb asked her once about retirement, and she said, never. I love coming to work every day. So I think that tells you about Mary Freiberg.
Mm-hmm. So we express our condolences to Mary's family, friends, and co-workers. We will miss her and truly appreciate all she's done for Scott County and its residents. On to the agenda. I don't see any amendments to the agenda, so if none, it'll stand approved as distributed. All right. The next item on the agenda is to approve the minutes of the October 1st, 2019 County Board meeting. They've been attached and distributed. Any additions or corrections to the minutes?
Madam Chair, I'll move approval.
I'll second that motion.
I'll note that I will be abstaining from this motion as I was not present at that meeting. So there's been a motion and a second to approve the minutes of the October 1st, 2019 board meeting. Any further discussion? If not, all in favor, please say aye.
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 All opposed, same sign. And I'll abstain. Motion carried. On to item 4 on our agenda, recognition of interested citizens. If you have an item you'd like to speak to the board about that's not on the agenda, now's the time to approach the podium and tell us about that item, limited to 5 minutes per person or per matter. Seeing no one, we'll move on to number 5, which is our Scott County Delivers presentation. We're excited to hear more information on mental health mobile crisis and the residential intensive treatment services. Welcome to the panel, and Chris Harder will get us started.
Thank you, Madam Chair. Good morning, Commissioners. This is kind of an exciting opportunity to talk about this intersection between many things we've been talking about over the last few months. You're going to hear today examples of innovation and some risk-taking and some creative thinking. You're also going to hear about collaboration with public-private organizations. You're going to hear about collaboration within the county. And the work that was done came from our existing strategic plan on decriminalizing mental health, but I also think it sets a great bridge for the strategic plan that we're moving into and how we continue to provide services in a way that's this creative. So I'm going to ask the people who are on the panel to introduce themselves, then ask our presenters to introduce yourselves. Danielle's going to say a couple opening comments, and then we'll get started.
All right, I'm Scott House, the Director of Emergency Management and 911 Communications for the Sheriff's Office.
Cindy Geis, Community Services Director.
Good morning, Jen Schwartz, Health and Human Services Admin Director.
Lori Reller, Adult Mental Health.
Steve Brown, Children's Mental Health.
Beth Sheets, Service Director at Guild Incorporated.
Jody Kieser-Kisting, Assistant County Attorney.
Buchanan, County Sheriff.
Terry Raditz, Director of the Mental Health Center.
Good morning, I'm Danielle Fox, I'm the Adult Social Services Manager here at Scott County. Thank you for having us. Do you want to introduce yourself?
Sorry, I'm Karen Jensen. I'm the supervise the Canvas Health Scott County Mobile Mental Health Crisis Team.
So as you can see, mental health crisis, we have a lot of crises, so people might be popping in and out as things go.
Yes, sorry for my lateness.
But we're happy to be here today. We had presented a Scott County Delivers presentation about 18 months ago, which provided an update on, as Chris said, some of the board strategy work. I think 18 months ago, we were in a good spot and we were excited about some new things that were happening and some developments, but I think being here today, I think we can really just appreciate the incredible work that's been done, the commitment that Scott County has had to mental health, and the partnerships that we've been able to bring to this table to make some really big things happen in our community. Just a couple of things to note. The mobile mental health crisis team, we've seen many more people served in the community. We've seen many more people who have been served outside of the hospital in their homes. We've seen some incredible new partnerships with law enforcement and other community partners. We also, I just saw pictures yesterday of structures going up for the new intensive residential treatment services, or the IRTS and crisis facility that Guild will be operating, which is really just incredible. I think we've been talking about that project for over 5 years, so to see those walls start going up is just incredible. We recently got information from the Department of Human Services just yesterday that identified our use of intensive residential treatment service beds. In 2018, our community members used 1,100 bed days, and in 2019, that's gone up to 1,900. So that's a pretty significant increase in just 1 year, and to think that right now all those individuals are traveling long distances or having to wait for services for a bed to be available is really, really great and really exciting. We also received grant funding from the Department of Human Services to have a half-time outreach worker for individuals who are experiencing homelessness and mental illness. So that just launched in July of this year. So lots of new, exciting opportunities. I think we've also identified some bottlenecks as we've grown services in some areas. I think we're seeing needs in others that have popped up, but I think we are lucky to have this great team here today to help us chart through those next challenges.
Thank you very much. All right, does somebody on the panel want to start the questions?
I can start.
Okay, thanks, Jen.
On page 9, the repeat pre-petition screenings. I'm curious about there's been a big drop in those, and so I'm curious what your thoughts are on how you've been able to effectively change that, but also maybe start with what that means, what a pre-petition screening is, and what, I think that would be helpful just to have some context.
I'll go ahead with that. A pre-petition screening is when a doctor will see that a client will need, a patient in the hospital will need to have court intervention to force treatment. Maybe looking at drugs or other services that the client needs, and we go to court and go through a court process to help the client get the help they need, that they're not recognizing they need that help. I don't know if I have a real systematic reason why those have dropped. I think we have tried to enhance some of the services that we offer individuals, so maybe that they're getting the help that they need and not needing to come back into service. But I don't know if I have a particular indicator, one indicator that would.
So the idea is,
The
we've
whole
done that
service-
once.
The whole service network is able to give them the support that they need
Okay.
and not needing to return.
I noticed the drop too, and I was really happy to see that. And I think some of the explanation for that could be that we as a county have had the opportunity to put some other innovative programs in place. Treatment court, some individuals that are participating in that might be people that we would have seen for a pre-petition screening. And I also think that the case managers do an excellent job of working with their clients when they have a commitment with them. A commitment expires typically after 6 months, but it isn't uncommon that the client wants to continue to work with the case manager on an ongoing voluntary basis.
Just a follow-up question to that same graph. Do you know, you mentioned something, Jody, about the treatment court. What do you think the impact will be when we have a vets court and knowing some of the mental health issues that plague the vets as they come back from service?
I think it's going to be an even greater impact. I think we potentially could see our numbers go down further. That's what I'm hoping for, so that's what I'm expecting that we will probably see.
Jody, just as a follow-up on that, are there things that, that you see from your perspective, like areas to build on, to sort of support those people in a better way? Like, it's really strong performance, but are there other things we could be doing?
I do think one of the things that's really important is because the county now has our own dedicated crisis team, I think that it's important that we spread the word about letting people know to call them. We call law enforcement regularly as citizens, but I think the more people that know about the crisis team, the better, because it's not criminalizing mental illness, but also it's yet another resource that we have in-house to help folks. So I think that would be something that would be helpful on it. That's the first thing that really springs to my mind.
I think another thing as a group that we've talked about a number of times has been around that total number of pre-petition screenings. And so are there things we can do prior to someone getting to that point? I think we hope to be preventative whenever we can. I think we've done a really good job of building up sort of those deep end services, but a lot of individuals in our community don't quite qualify for those. Maybe they're not interested, or they might not need that level of service. And I think we have been strategic about making sure that we're only serving people at that level that we absolutely need to. And so what can we put in for prevention to help it?
I think the outreach position is really key and important here, and I'm really happy that that went through. It's not uncommon that we speak with citizens and they don't meet the level of services yet or commitment, but yet something needs to happen, and so that's a really great precursor.
And can we just clarify, is the halftime outreach worker, is that a county employee, or is that person associated with one of the private agencies?
That person is employed by Guild Incorporated.
Okay.
And this is the first outreach that we've had in our community. And it is specific to individuals who are homeless. There's a high focus on long-term homeless, but it does, I think, meet some of that need. I think we would still like to see some general outreach for all individuals who have mental health needs. I think a lot of times we'll get reports from the community or family members or others who are concerned about an individual. But right now, the only mechanism that we have to send someone out to them is if they are meeting that criteria for the mobile mental health crisis team. And in that instance, they also have to be willing to receive services. So we don't have anyone who can go out and try to engage someone and get them interested. It's sort of like either you meet this threshold and you're really interested to move forward, or we have to wait until you get to that level.
Jody, you talked about the difference with law enforcement going to scenes. Can someone walk through the difference between what we see on page 7 with the percentage of individuals in crisis offered services within 4 hours of request? Kind of talk about what that slide does for us, and then compare that with page 10, which talks about the law enforcement mental health events that were pulled from the system. We talk about what's causing the difference in numbers between those two slides, and should it be that way, or what are the strategies that we're implementing to close the gap there?
Maybe I can field this at least first. So this figure comes from the Mental Health Center statistics, the first graph on page 7. And those are individuals who call the mental health center or a family member calls, and we get them in for an appointment within 4 hours. The percentage, which you can see is really high. It would be higher, some folks choose to wait longer than that, which are not necessarily the same, all of the same folks that law enforcement is dealing with, because these are people that call us and ask for crisis services.
And so when we're looking at the information from law enforcement, those are people, and Sheriff Henning can certainly speak to this much better than I can, but those are people who are contacting 911 because they have a mental health need. I think when we see that, that says to me, that's the last resort. I mean, you are desperate usually at the point when you're calling 911. And I think those numbers are reflected across our system and the need that comes out in those 911 calls on page 10. But what I would compare that data to is page 12 as well, with the numbers related to our mobile mental health crisis team. I think our hope is that our community members can contact the mobile mental health crisis team instead of 911, or that they can get their needs met prior to that. So the dispatch data tells me that we still need to do some community awareness and engagement about Canvas so that people know that that number is out there and they can get a mental health professional to actually come out to their home and do an assessment and provide some short-term supportive services.
And one thing I would note on the 911 calls is what we used to see is a lot of repeat calls. So we'd go to the same house multiple times in a 3-day or a 7-day window because of that crisis. So I question maybe there is some intersection there where we're going, but also getting them some resources and not going back multiple times, but getting them in touch with the right people. And that would add up to the time we started sending more of our deputies to crisis intervention training. And through that training, that's where they get a lot of the knowledge of how the whole system works, not only how to de-escalate, but also how the system works. So in 16 is when we still really started ramping up, and then 17, 18 is where we sent every deputy to that training. So there could be a correlation there as well, that because I do feel we don't hear about those consistent calls anymore, especially now with Canvas in play. We don't hear the deputies or the officers complaining about that, geez, I keep getting called to the same house, I have no resources or tools to provide them. It seems like we get that call and then we don't get the further calls because now Canvas takes over that follow-up and provides those services, as well as I know when the deputies on scene are providing services, or even before Canvas here, going back to the house when they're not in crisis and explain to the family what some other tools are versus waiting until it gets to the point that a police response is needed and or arrest is needed, but helping get some resources in early. So there's some possibilities there that could explain it.
So I have a question, and it doesn't really pertain to any kind of graph, but it's more global. And, you know, when this topic came up, I kind of was Googling all different types of things, looking at trend data, and it's amazing the amount of data that's out there. But, I mean, all of the data that I've been reading was all talking about awareness. And it's not only awareness for the person that is experiencing mental health, but it's also an awareness of everybody around them to be able to identify it early. And my question is as you're going through your strategies and as you're looking to make improvements, what is the methodology that you use in educating just the general public on mental health and mental health issues globally? And I look at the trends with teen suicide and even adult suicide and trying to get in front of that. I think most of us know someone who has some loved one that's committed suicide, and I'm like, how do you get people to be more aware? So can you tell me a little bit of the strategies that you're undertaking, not to address something maybe very targeted, but globally for me to look at people, and if I see, because I'm educated, and maybe things that it kind of mirrors like a mental health issue?
I can, I'm sorry.
Yeah, that would be great.
I can start. The Mental Health Center does a lot of training. I think last year we did over 50 trainings for the public, the schools, social services, different departments about mental health awareness. We did one, or I did one with Fish around suicide prevention. I think we did 7 with the different school districts about suicide prevention. This fall, alone before school started and shortly after school started, we've done 6 in the school districts about mental health awareness, symptoms, what that looks like in the classroom, reducing stigma, and suicide prevention. But we're always letting people know whenever we have the opportunity that we're eager to come out and do trainings on various topics. And so that's, from the Mental Health Center standpoint, that's what we're doing.
Just one follow-up. What kind of, like, social media do you use, for people who are out Googling? Some people are big Facebook folks, and so they're out there and then they see maybe some session. Do you use all the different types of social media, or do you have any idea, even of attendance or people, a number of hits, how interested or how direct people are in trying to educate themselves?
I think we have tried to utilize social media so that there's an awareness about the programs that we offer services for. And so Lisa Koner has been helpful in getting things posted out on neighborhood sites on Facebook and all of her other venues that she does that with. I think we would certainly love to see more community awareness across Scott County and across the state and across the nation about mental health, because I think that has been something that our community continues to bring up. And so Terry's crew has been able to offer wonderful trainings, but I think it would be great to see just more general community awareness, absolutely.
Thank you.
Sheriff, would you be, I know the Vitals app is new, but I'm wondering if you could talk a little bit about how your office is experiencing that and kind of where you see that going forward and how it impacts all this.
Yeah, so the Vitals app is something we started, went live I think a month ago. And it's basically all of our officers now on their smartphones have an app that when you get within 80 feet of somebody with a beacon or the application or one of the devices sold by Vitals, they would get an alert that would provide some basic data on that person that would say, this is my son who's on the autism spectrum, or this is somebody with persistent mental illness, choosing whoever they want to sign up and provide that information. So a classic example would be a mother with a child with autism may create a video on the app that we'd be able to play to the child if we see him wandering or they're in distress with mental illness. It may give some techniques of how we should speak to them or respond to them, or it might say they're more comfortable with a female officer. It could be whatever they choose, as well as contact information for loved ones as well. So we may not have to even engage that child. That's maybe a suspicion call in the park that everybody's like, what's that kid out here doing by themselves? We may get within 80 feet and go, oh, now we know what's going on. We can call the mom and she may say, oh, I'm across the street, I know he wandered over there, versus getting into some type of use of force or interaction with them that isn't even necessary. So our main goal is pushing it out, is trying to we need the clients to use it. So now the deputies have it, but chicken before the egg type thing. If we get it, my thought is then hopefully now the clients will start using it in some of our services, and it'll be another tool that'll help us engage them and be aware. And with our entertainment venues as well, a lot of our bigger communities like St. Paul, Ramsey County have been doing this for a couple of years. We know we get a lot of visitors to our entertainment venues. Our deputies may interact with somebody from another community that has that application. So it's a good tool to have, but it's also takes a while to get that trust built up and people to get out and get signed up, but hoping there'll be some success stories to share soon.
Is there and right now that's just in the Sheriff's Department, is that right, or just
Yes,
city? Okay.
just the Sheriff's Office is
Okay.
enrolled.
So is there a plan for that to go broader, or
The police,
maybe?
cities are all aware of it. We've talked about it for a couple of years now.
Okay.
That's the presentations.
Okay, thanks.
We're also talking about the crisis team getting it too, so that we can help out if we're on scene and somebody needs extra help. So, and we're working with the Sheriff's Department with that. We might add on to their app that they already have.
Yep, we're gonna add a few profiles for
Yeah.
them to use, and that'll be another tool that
Oh, nice.
would give them information too if they go to call.
Karen, does your team, when you go out, do you always go with someone from law enforcement? or
No,
you never
we
go with-
rarely go with law enforcement. They're there if we need them, and we know that we work really closely with them. But we very rarely go out with law enforcement. typically my team goes out by themselves.
Okay.
Yep.
Okay.
Can we shift to page 13, the outcomes for case management referrals? This was kind of surprising to me that of all the referrals we have, we only have about a third that are actually converting to case management. So I was just curious, what are the reasons for that? What happens to those folks that we don't get into case management? What, is there other things we're doing? So.
About a third of the clients do go into case management. I think about a third of the clients may either not decide they don't need the service, or they may get their needs met while we're working with them in the assessment. Sometimes clients might need some help getting on like medical assistance or some type of program, and once that's done, they really don't choose to go on for services. This data is really going back a little bit. I really think our 2019 data will show that we are engaging more clients. The intake department has done a lot of changes, trying to outreach a little bit better and make sure that people make appointments. I know we had trouble with getting people to appointments, remembering appointments, and so I think some of the changes they made are going to actually improve the stats of the number that make it to the through the assessment process.
You can see that chart is also tied very closely to page 14 and 15. So when an individual calls in to case management to request services, there are a couple of touch points before they actually get assigned to a case manager. So someone calls in, page 14 is the amount of time that it's taking us from that call to get someone out there to do an assessment. So right now it's about 30 days after an individual calls in and requests services. Within these first 30 days, we're seeing about a third of those people drop off. Then if you go to page 15, that's the second step. If they meet the assessor and it's determined appropriate, this is the timeliness of getting connected to a case manager. So from the day that you call, it's taking about 60 days till you get assigned to a case manager, which then will take some additional time to get that case manager actually out to do a face-to-face. So as Lori said, some of that is because maybe people aren't interested, maybe they're not appropriate for services, maybe they get their needs met, but I think we also suspect that there's just some disengagement, particularly for our people who are experiencing a lot of mental health symptoms. I think it's challenging. And these 60 days are a barrier for people getting into services. We also have right now a pretty full plate in case management. I kind of alluded to earlier that we have been really strategic around the cases that we're taking into case management to make sure that they in fact need it. Part of the reason for that is just because the team only has so many slots, and it's taking some time for us to find some availability on those caseloads right now.
Do you have a goal in terms of days to the interaction? Is there a state average, or is there a goal that you're trying to get to?
There's not. I think I would really like to see it be within 30 days of having somebody call and then get assigned a case manager within 30 days. There are steps that need to happen within that as far as getting a diagnostic assessment. But in the meantime, even if it is 30 days, I think those people still have a lot of needs. And so my hope is that someday we would have some general outreach staff that could provide some engagement to those people within those 30 days to try to get their their immediate needs met. We also have our Anchor Center, which is our mental health drop-in center over at the Career Force Center. That right now is only open 2 afternoons a week. So ideally, people in that waiting time, or maybe if they're not meeting that criteria for those deep end services, could go to that site, meet with some of our team members, and get connected to services, as well as have a community. I think part of some of the challenges we see with mental health is there's a lot of isolation. And so when we pull people in and engage them with activities at the Anchor Center, I think we're less likely to see a need for some of those deep end services.
To follow up on the question on the people that aren't, the grid on page 13, of people that are not interested or no show or not eligible, et cetera, or decline service, do you still track these folks knowing that there was a call at one given point, and whether or not their needs were met or not met, or how many of these people do you see post the initial the initial information that you receive?
I think when we look at the data, and this team has really done a lot of work to dive into that information, and they created a beautiful spreadsheet that we were able to go through even line by line and see what happened with individual cases. We see people coming back time and time again because maybe they felt like they didn't want services at that point, or maybe things got worse and now they needed to come back, or maybe it was that waiting period. So different things are happening in people's lives, I think, but we are seeing people come back, and sometimes when they're not able to get their needs met, those needs have then gotten more intense, and those, I think, are the individuals that we see end up in pre-petition screenings or in some of the institutional settings.
Do we know anything about, like, is there any commonalities between the people who don't follow through? Like the people in that third that?
I think from my perspective, that is somewhat unknown because we don't have that outreach component that's going out and engaging with that person. And sort of knocking on the door and saying, you know, are there ways that we can support you? Is it a transportation issue? Do you just need to get more comfortable with thinking about accessing the services? I think that's an unknown. I think this is really good information, but we would like to see more depth to that, yeah.
So potentially another function for that outreach worker is understanding some of that why people. Okay, nice, thanks.
Karen, I was curious, you're about a year and a half into the Canvas program, I think, if I remember right. What's been the most challenging aspects for your team?
I would say staffing. We just, there's not very many of us, and I think people think we're like this huge group, and we're not. So it's always a juggle on figuring out who's going to go where. And then I think one of our biggest things is transportation too. We don't transport clients at all. So especially if we go out and do an assessment on somebody and they need to go like to a crisis bed, if they can't drive themselves, which is usually the case, we try to find a family member, neighbor, friend, anybody to drive them. And we've had several situations where there was nobody. And as people are aware, our nearest crisis bed is quite a ways away, and the one we have the most luck with is in Mankato. So that's quite a distance to try to get people there, and then, of course, back too. So I think transportation's a big piece, and just not having enough staff. I mean, we're busy all the time. So I'm seeing our numbers really increased since September of this year with school being back in session, so.
Which actually is a good thing for us administratively, because I think when we were first forming the team, our numbers were so low that we had a hard time demonstrating that need because we weren't having people access the service. And so our hope, I think, is that we will be able to advocate for some additional state funding now that we're seeing these numbers increase and it being consistently busy, as Karen said.
Karen, can you talk about the time of day that you're receiving phone calls, kind of your workload as it's spread across weekends, nights, holidays, traditional business hours, and how you manage that?
That's a great question. So I don't have the data with me today, but we get calls all sorts of times. I would say a good chunk of our calls do come during the workday, and I think part of that is because that's when my full-time staff are working, is during the workday. But we definitely get calls weekends, evenings, holidays. Labor Day this year was extremely busy for us. I'm not sure why. Like I said, I think September 1st hit, and then like everybody decided they needed mental health help, which is great. I mean, we want to be there for people, but I would say a good chunk of the work we do is done during the day. And because we're working with people in crisis, I think it's smart that we have our staff there majority of the time during the day, because they want to meet with us during the day versus evenings and weekends typically, especially in crisis. So we're able to get a lot of that work done through the workday. I'm not saying we don't do stuff after hours. We certainly do. And if somebody needs to see us in the evening or weekend, of course, we'll see them. It doesn't matter when they need the help. We will definitely get there. But I would say a good chunk of our phone calls come in during the day.
How does the service differ then from when you have your full-time staff on during the day versus after hours. How does the response, how
Yeah.
is response impacted from your perspective?
So our response is always, we usually get to the point to do the assessment within an hour. The state guidelines are to try to get there within 2 hours, and so we usually get there within an hour. Our after-hours staff are all on call, so they work out of their homes. So depending on where they live, they have to be within a certain radius of Scott County if they don't live in Scott County to respond. So they are, ready to go. They're not coming from the office here, so sometimes there's a little bit more travel with that, but that hasn't been an issue. We do have another group of people who answer our phones after hours, and I think it's First Call for Help, 211, and they have specially trained staff in mental health crisis. So they have been triaging our calls well. I don't feel like there's been any issues with people not getting what they need after hours either. So.
Then one last question about Canvas for now.
Yeah.
You talked about not having transport capacity right now. If you can't find a friend, family, someone to provide that that transport with, what are your alternatives? What do you end up doing?
So that's a great question. So part of our initial assessment with clients is doing a safety plan. We actually do a very robust plan on how to keep them safe. So it may be, can we keep them safe until tomorrow when they have a ride? If we don't think we can, they may need to go to the hospital to get, unfortunately, another assessment and then be hospitalized. If we do end up having to send somebody to the hospital, we have really good relationships already with the hospitals in the county. We will call ahead so that they know they're coming and give them a full, pretty full clinical details on what's happening. But I would say that doesn't happen very often where they have to go to the hospital. We're usually able to figure out an alternative plan. But there's been a few lately that have been really hard, and my staff has spent like many extra hours just trying to figure out the transportation piece. So, yeah.
So I have a question about one of your challenges, what's not working well is the lack of accessible and affordable mental health services across Minnesota. And again, me reading up on this going, I mean, they really talk a lot about insurance industries and insurance industries saying, we don't cover mental health issues. And is there, number one, from a state perspective, do you know any initiatives to address the insurance of affordable health care, including mental health? Is there any initiative at the legislature or some other fashion to try to address that? And in addition to, when you say lack of accessible, where are the mental health centers in Scott County? And are we seeing that there are those that are they not accessible because the amount of time that they're open, or are they just not close to anybody? Or people aren't close to a center?
Any of you can
Yeah,
probably
sure.
really speak to that. We would love to see, I think, some energy around the legislature, but I think that the health plan coverage of mental health services for our team internally has been a significant challenge because there are many plans that just don't cover things. For example, our mental health case management. But, I mean, you guys all probably have really good examples of that.
I can speak to, so for outpatient services in Scott County, we're in a really good place. The Scott County Mental Health Center, accepts all insurance, MA and Medicare. So for a lot of people, if they're on Medicare, which a lot of our SPMI clients are, there aren't very many providers that will take Medicare because the payment is low, but we do. We don't, have a limit of Medicare clients that we will take. And so for outpatient services, we're in really good shape here. There's also outpatient clinics, kind of across the county, even in our smaller communities. But we have struggled with, that's like IRTs and inpatient, and particularly hospitalization, our hospital beds. And I think Lori can speak to that more.
Yeah, that's a real problem with some of the insurance plans, like we want to send someone to a IRTS program, intensive residential treatment program, and if they're on a private insurance, their spouse's insurance, or some of the clients at work, they won't cover that. And so we're trying to look for services in the community that can support them, and often there really isn't any. Things like the ARMS programs, the rehabilitation services, don't take private, can always be service private individuals. So we're trying to find a resource, or oftentimes we just have to try to fill that gap ourselves because there isn't a program that we can plug in.
And I think people who speak English as a second language is another challenge to try to connect them to culturally appropriate people. We just don't have really many people in our county that speak other languages, especially therapists. So that's something that we've run into. Trying to find them a resource, and oftentimes we're sending them up to the cities for that type of service. And then transportation becomes an issue for that too frequently, so, yeah.
Beth, I wonder if you could talk a little bit, one of our aspirations is to have more partnerships like the one that Scott County is forging with Guild, and to be able to bring private agencies in to partner with us. And I know, I think Danielle said they're just putting up 2x4s in your building, so it's a little early to talk about program outcomes. But can you talk about, were there things that we could learn from in terms of engaging a private organization such as yours? Were there pieces of the work to build that partnership that you had found helpful, or maybe where there were some gaps?
I don't know if Danielle might actually be able to answer this a little bit better. I have come on more recently.
Okay.
But since I've been on since February, I would say the experience has been really great. I mean, Danielle and Pam are available. We're meeting with them regularly, talking with them. So I feel like it's been a really collaborative approach, and I think that Guild is excited to be here and would love to provide an array of services in Scott County. I think we're hoping that the IRTS in Crisis and our outreach worker is just the start of that. I think a lot of the things that we've talked about, barriers just in general, health insurance, transportation, those are barriers just that we're all facing, and those do get in the way of the collaboration. But I think it's an exciting opportunity, and I think a lot of private providers like us and like Canvas do want to and see the importance of partnering with counties so we can best serve our folks.
Nice, nice. Are there any things, Danielle, that you would add to that in terms of what we could learn about fostering an environment that would bring private agencies into Scott County?
No, I think our initial meet and greet with Guild took place at our local mental health advisory council, and just sort of those beginning conversations and finding an agency that's mission driven. And I think a lot of times we identify a lot of barriers of why someone isn't here, but I think when there's been commitment on both sides to just work through whatever those issues are, sometimes it takes a while, but we're able to make it happen.
Are there things we can replicate?
Well, we really hope that there's a pot of gold out there like there was with the state funding that we received for the IRTS facility. But I think just that ongoing communication was essential for us to make that work.
Okay, thanks.
We've been talking about private insurance. Does the data that's in the packet talk about just the services the county's provided, and how is the interaction between those who may seek private services and at one point in time then interact with county services? How does that work? Are we tracking those who are seeking private services first? And if someone does start in the private sector getting help but then comes into get more assistance from the county, how do we know the history that the person's gone through, and how do we manage the back and forth? If that wasn't too convoluted of a question.
Well, I can speak to that regarding, because we are a provider for pretty much every health plan, and MA and Medicare, as I said previously, and then we also offer a sliding fee to those who don't have insurance at the mental health center. So we have a lot of interaction with folks that have used private providers. Every service starts with the diagnostic assessment, and part of that assessment is to contact all of those previous providers to make sure that we have all the records and that we've reviewed them so that there's no gaps and that there's, no missing pieces or a wrong diagnosis per se for the client.
And I think we really value those private network providers because I think it takes the full continuum to make that work. When we're talking about county services, Typically, those services are focused on individuals that can't access that private network for whatever reason. It could be individuals who are on medical assistance and need support. It could be individuals who have such a deep end need of service and that the county is mandated to ensure that that's covered. For example, like with the crisis team. So I think we try to partner with those networks as much as we can to make sure that our overall community needs are met.
I have a question about, on page 16, you have the CASI, or CAS2, I'm not quite sure how to say CASI scores. Looking at these kids and knowing that they've experienced some level of trauma, my question is, how or can you engage possibly other departments when emotional issues exist within a child? Maybe it has something to do with chemically abusing parents, just other type of home situations that may also impact their ability to continue to improve. And by the way, I did want to say from 2012 to 2018, that's a substantial increase. And so good job there. And the questions are, how do you continue to improve that? And what type of ability do you have to cross-share kids' information across multiple venues to make sure that these kids their issues are being addressed?
Children's, that's a whole nother area.
Well, you were pretty quiet, Steve, so I thought I'd make sure that you were playing the game with the rest of them.
The CASI score, so we're dependent, anytime you do, case managers we do the assessment of needs, we engage families to, in terms of what they're looking for, help them identify goals, where they want to go. And then we're really looking for the mental health center, we're looking for community supports to plug them into in terms of, so we're developing plans so that they can get the services that they need. So it's a cooperation between case management and the community service providers, and the service providers are the ones who really kind of drive the CASI. So we do that kind of in cooperation. So if we identify the needs, we get the services in place. The hope is that we're improving CASI scores. And so case managers are doing exactly that. They're coordinating with schools, if there's a probation officer, if there's often with crisis team in terms of developing crisis team plans and making sure that they have that information. Sometimes it's with older adolescents and we're making the handoff to adult mental health. And so that is the job of a case manager, to make sure that they understand the needs, they understand the services in the community, and that they're doing tight communication and coordination with those service providers. And that's a lot of work. Sometimes you're right, the parents themselves have their own trauma, their own chemical abuse issues, or they're just, they may not have a trauma or a serious mental illness, but they got 5 other kids. They may be a single parent. They may be a parent who has divorce issues or marital issues, and all those things impact CASI scores. CASI scores have to do with safety and child functioning and family support, family disengagement, child engagement, and so there's a lot of different scores that can drive a CASI. You can do really well in other areas. And if safety is super high, that can drive a CASI score pretty poorly. So it takes a lot of finesse for case managers to engage a family. It doesn't matter how many services are available, but if you can't do a good job of expressing concern and care and helping them understand that you understand what they're asking for and help them move along at a pace that they're able and willing to do that, it takes a lot of finesse and skill and a lot of support.
So are there barriers with working sometimes with parents who a child is maybe being reported as potentially having a mental health issue and the parents are more disengaged, or they don't really want the county intervening, government stay out of my house type of thing? What do you do, or how often does that occur, and what are your challenges, and how do you impact, or do you have to remove the child, or how do you move that forward?
But Children's Mental Health is a voluntary service, so we're always reaching out. So we can get referrals by hospitals, mental health providers. Unfortunately, those are the ones that often don't connect because sometimes they may not know a referral's been made on their behalf, or they're just not ready to receive the service, or for a lot of families, they're already plugged into psychiatries and they're plugged into outpatient therapies, and so they may not see the reason why they're doing that. So there's lots of reasons why families don't get connected, but there are some families who maybe have had a poor experience, or the face of the county, so there's a lot of barriers in terms of how do we do that well. We do calls, we let them know that someone has made a referral on their behalf and they're concerned about them, and we're available to help you, and if you want the service, here's how you can contact us. So we'll make a number of different telephone calls, and then we'll also send a letter out to let them know that we've reached out, and if they don't call us back, we're offering some sort of services.
What percentage of those families take you up on it? You said this is something that you offer that's not mandated, that you're offering it as a courtesy service to these families. What percentage of kids or parents don't become engaged? Do you have that statistic?
Ours is probably about 40-60. I think 60% receive the service, 40% don't get connected, or don't feel like there's a need. Or maybe open an assessment work group and work, because there's always the demand, coaching case managers to assess, is there a need for case management, number one. Not to assume that because there's a referral, we jump in and do a 6-month plan when it's not needed. And so how do we use resources and our own resources in a responsible way? So sometimes opening may be a good decision.
Can you share that openly with the schools, or is there has to be an authorization? I guess looking, if they don't want your service, at least there's a school mental health professional, I think in most of the schools, or maybe not.
Yeah, I can speak to that a little bit. So, of course, the parents need to give permission. We don't go and do therapy with them or a diagnostic assessment without the parents wanting that and being part of that. Last year in the schools, we did 385 diagnostic assessments for kids, and all of those involve an assessment for trauma. We also did probably 25 to 30 trainings on trauma-informed classroom and trauma-informed school. The schools are very receptive. We're working also with public health nursing regarding ACEs and helping the schools kind of understand how a child presents differently when they have trauma. And the schools have been wonderful partners on that. Regarding parents, just some of the kind of things we've done lately, always, like I said, we involve parents in all of that. And they're involved in a treatment plan every 90 days. They come in and we talk and sign the treatment plan and the goals. But some of our more recent projects is we have a grant, we've received 3 grants from the state for trauma-informed care for students, and they're programs that are evidence-based, and we've been implementing those. They're at different levels, high school, middle school, and the one we just got is Bounce Back, and that's for elementary-age kids. And part of that program is a component for parents, where you bring parents in, and they learn about trauma and other mental health symptoms and what those might look like with their kids. And then it also involves groups for teachers. That's been very well received. And a second project that we did last year, also grant funded, was we did groups for preschool parents. It was great because we were able to, because of the grant, have childcare and have a meal for the parents or the families. And the whole topic was understanding the connection between trauma and other pieces and your young child, and how that might look in terms of mental health. And that was very well received too.
I think another part of your question, Cindy, was just around that shared data and how do we work together. Many of the supervisors from these teams come together on a monthly basis to talk about how things are going, are there cases that we can talk through, and data sharing has definitely been a topic of discussion. I think we want to make sure that we are providing the best service possible, and having information can really inform that. But we also have to be respectful of the legal implications of that and the privacy of that individual. So I think that's something that we continue to work on, and I think we are trying to create systems where we can effectively share data and agreements. But I think beyond the individual data that's being shared, really the trend data that we're seeing from all of these teams and looking at that collectively has helped us identify some of those service gaps and really get the full picture. I think we, as the county entity, only have one piece of this pie, and so having more information from all those partners has really helped inform our actions.
Thank you.
Before we turn this over to the audience for some questions, I just wanted to, you've all spoken really clearly about challenges in transportation, some insurance barriers, and the need for some public awareness building around the crisis team. As you look forward into like the next year, say, as your team looks forward into that, are there other things that you're going to work on? Are there gaps or weaknesses within our crisis mental health service array that draw your attention as a priority over the next year?
Well, I think we've spoken about the outreach and engagement need, and really just that need to try to engage individuals or engage families, whatever that may be, through community awareness or through mechanisms like people who can dedicate some time to doing outreach. I think we are really interested in how we can decrease that time that someone is waiting from when they express that they want services to actually get them in the door if that's appropriate. And part of that is that capacity on some of those teams. I think we have had a lot of conversations about mental health and the overlap with homelessness. And so exploring what might be some options so that when we have really vulnerable individuals, we can find a way to meet their needs immediately. Other thoughts for the next year? We also are working on exploring jail diversion and what does that look like. And so I think we're in the beginning exploration stages of that. I think it will probably take us more than a year, I would assume, but I think that's one thing that we're excited about learning more.
Nice. Thank you. Questions from the audience?
I have one question just in follow-up to that, Danielle. One of the things on page 2 that you identify is an ACT team as a gap. And just for the audience, because I'm sure not everyone knows what an ACT team is, but then more specifically, my question is, we looked at this a while back, probably when we did the original board strategy work, and at that point our numbers didn't support that we would have the numbers to support an ACT team in this community. Do you think that has changed at all, and do we need to be looking at that?
I don't think we've seen a drastic change in the numbers. I think what we're seeing is just a lack of those overall community supports. And so I think an ACT team has been a resource that has served some communities, but because of our size, we probably are not going to be a good fit for that. Could we potentially partner with another community to have a joint ACT team? Potentially.
Can you tell folks what an ACT team is?
Sure, it is an assertive community treatment team. And so some larger communities have these teams where they have a nurse on staff, they have a psychiatrist, they have outreach workers, they have mental health professionals, and they really focus on those really high needs individuals and sort of wrapping them around with services and connecting them very quickly to help connect them to housing, to transportation, to ongoing services. Maybe they would be utilizing the crisis team or the IRTS program. So it really is a really high intensive group, and I think they only maybe work with caseloads as low as like 20 individuals. But we just have not seen that level of need yet. I think we will want to be mindful about what that's looking like in the future, and does that need grow for us?
Does Carver County have an ACT team?
They do not.
So would there potentially be some partnership there with Dakota or Guilds in Dakota?
It could be a potential. I think there's concern just around the size of that coverage area, but I think definitely worth exploring.
Okay.
I do think right now that the crisis team provides a lot of that. I'm not saying we're an ACT team, but I think when you look at our data, we do a lot more stabilization appointments than we do assessments, and I think it's because we're providing them with a lot of services to get them connected to the right people. So I think if we, it's all about balancing. We certainly can keep doing that, but our capacity is getting pretty full too.
Other audience questions?
I don't want to talk into a microphone, but I'm a case manager with the Adult Mental Health Unit, and I do the assessments. And so I just wanted to follow up a little bit. I think you had asked about what the reasoning might be for that large, like a third of people with no contact with us, because I'm the person that's doing this and gathering the information. I just wanted to say that the majority of those folks, I would say, are not self-referred. They are referred by someone else. So a lot of times, like the hospital, if they're in the hospital, the social worker will just make that referral and not even tell the client. And so when I follow up with them, they're not interested. They don't even know what we do. And so that might also attribute to the recidivism piece, that maybe they heard about us and then later on they come back. So simply that they were referred with no contact doesn't mean that there was a failing in the system. It was more like the source of the referral. And then and we do have this data, but if people refer themselves, the follow-up is very good. The other piece of that I wish we had the slide, because I'm happy about this, in 2019, that would look a lot different as far as the outcomes, because we have 52% of people coming into case management now this year so far. So it kind of speaks to the outreach piece of it that we are doing, more calling more often, reminding people of appointments by texting them, and just more assertive in that way. And so people are able to follow through more with those reminders. So I just think that's important to kind of note that those changes, they are happening. Mm-hmm. But we do only have, I only do this part-time, and I'm the only staff that does it. So when you look at our numbers, it's a lot of people. And so it's challenging to engage people quickly with just time.
So I have a question for Dr. Raditz and Lori. We had three, through the building assessment and discussion for space, 3 units really talked about a need to change. One was the Anchor Center, one was the Mental Health Center, and the other one was Public Health. And I think those are really being accomplished through the new building. What Dr. Raditz does additional space, right now you have like 6 rooms and it's hard to shuffle people. What will that mean as we have a baseline now moving forward to helping move people and hoping into the system sooner? And the same thing to you, Lori, what is that Anchor Center and the space revisions going to mean to folks with mental health issues moving forward?
Well, for us, it means a great deal. We can see more clients at the same time. We don't have to wait to schedule people because we don't have space for them, which is really critical for us. And it's also a contained space, which is really helpful when some of our clients are involved in other departments, but not necessarily in a way that they love. And so they have a little space now, so they're not in the same waiting room with, maybe seeing a worker that they were involved in a conflict with. So, yeah, we're very happy. Thank you.
What will the capacity increase be, do you think, in being able to see people or to move them through? Have you done some looking at that now over the next year as we start to plan to move?
Yes, well, basically, we can see, right now we have 6 rooms where we can see clients, and we'll have 15. Right now, we can't do groups in the mental health center. We have to go somewhere else in the building, and we can only do 1 group at a time. We'll be able to do 3 groups at a time. So we really will be able to hopefully see everybody that calls in at the time that they want, if the therapist is available, rather than, right now we have to schedule a room. The therapist and the client all have to come, have the same times open, because they have to share all those 30-some FTEs. Now, some of those are in the school, but 30-some therapists share those 6 rooms to see clients. So, yeah, it's going to be, I think, really capacity building in terms of our services.
And both of those facilities, I'll let Lori go next, have their own access and independence, so talking about trying to design it so it fit the needs of your clients as well.
And that's what we're hoping with the Anchor Center, that we'll be able to have maybe some evening or weekend activities, things that we aren't necessarily able to offer now. I think our biggest need would be, as we move to the new building though, would be to increase our hours. Right now we have like an open drop-in that's about 6 hours a week. We have some special activities, but really we could be a resource to people throughout the week and really accommodate people that work and have some evening activities, but we just don't have the staffing to do that at this point. So we're hoping in the next few years while the building and the renovations are happening that we're going to be able to increase our funding to be able to be open more and offer more services to individuals.
So I have just a general question. Can any of you share your experiences with successes in reaching out to diverse communities? When we were doing Shakopee Diversity Alliance work, we found that some of the groups were pretty reluctant to ask for help or to want to admit that there was such a thing as mental health problems or issues. Are we trying anything that's effective, or are you aware of some initiatives that have worked well?
Well, I can speak a little bit to our services in the school, our Connect program. That seems to be a really nice common ground place for people to get services. We have substantially higher number of folks taking part in those services in the schools in terms of people of color and diversity than we do in the mental health center. But that builds trust, and so we've had experiences where, because of the trust was built in the school, then the families are coming in and requesting services in the mental health center. And we've done some of the programs I was talking about with like parent support and parent enrichment around education, around mental health. Those have been strongly attended by our communities of color in the schools.
I think we've really tried to be strategic in how we move forward with our planning and consulting the Diversity Alliance or the Shakopee and Mdewakanton Sioux community around the development of the IRTS facility. I think we do still have some work to do there, and I think we have some data to look at. One of the things that we talked about as some of our next steps with case management is for those folks who are dropping off of services, is there an impact to race or other diversity factors that are playing into that? And then what can we find out about how we can improve our services so that we can be accessible to the full community?
I have a question about data sharing. Having worked with the legislature, I realize that they are not going to approve any data sharing without patient or parental permission. And so are there other barriers that currently create silos? Can you ask for that permission and get it from the patients so that you can share? Are they reluctant to do that, or are there actual laws that prohibit you from doing that?
Speaking from the legal side of things, there are laws that do prohibit us from sharing confidential data, even if the subject of the data does agree to have that data disclosed. So we always have to make sure that we're consulting the statutes before we're answering questions about that. But there are other instances where the subject of the data can consent to having the data disclosed and shared with other departments within the county or entities outside of the county as well.
I think we also see barriers just in mechanisms that allow us to share that data when we have the permission and the authority to do so. So most of these teams are working through different systems, and so it can be challenging just to transfer information from one team to the next, even when we do have permissions in place.
Hi, I have a question about crisis services in the county as we've transitioned to our own team instead of the collaborative team. The after hours piece with Crisis and Canvas, just wondering if there's any plans to make that a more smooth transition to after hours and weekends. Right now, when you call, you do get 211, and you have to relay the information to them, then they dispatch someone else who may or may not go out in person. So wondering if there's any opportunity to expand what Canvas can do as far as mobile crisis assessments or assessments after hours, that's not through this like third-party system.
So when we developed that system, we really had to be creative. At the time of the new team being implemented in Scott County, there were some significant funding gaps across the state. But I think in our community, Canvas was running a statewide phone triage system, which was then defunded by the Department of Human Services. And so that system initially created a lot of efficiencies for us and other communities to be able to tap in to that line and the staff that were already working on that team. When they lost that funding, there was a big line item that was missing. In addition to that, when we applied for funding for the crisis team to the state, we did not get even half of what we requested, and I think we requested conservatively. So at this point, I think we are making it work, and we hope to advocate for some additional funding, but those are just sort of the limitations that we're living under with the state grants.
All right, Madam Chair.
Thank you, everyone. What a great presentation. It's so good to see our progress on this issue, on an issue that was identified. I know we have some comments from the board. I'll start with Commissioner Wolf in just a minute. I want to clarify one thing, just because all this data we present, sometimes with public or media or things, I see little pieces of it picked up. I do want to just confirm. So when people are calling our crisis hotline or they're calling the mental health center, the data's in here showing that they're, either within an hour or 4 hours, almost always helped, gotten some resources, that type of thing. I just want to make it clear that the data being shown on case management, those are people who are looking for more intensive services, who qualify for those intensive services. It's a subgroup and can't be getting those other places where we're looking at that 30 to 60 day wait. So very different. Not wanting to just make sure that it's acknowledged by everyone that no one in crisis is waiting 60 days. This is a different level of services. And again, when we accumulate all of this, sometimes that gets confusing. So am I correct there?
Yes, that is correct.
All right, Commissioner Wolf.
I just was going to ask, you said, around September 1st, there's a lot of activity. Is that unique to this year, or is that?
That's a great question. So we've only been here about a year and a half, so it's really hard to compare data. We do have data from last year, and yes, we are busier than last year at this time. But I don't have a lot to compare to before then with this specific.
I thought it would be around Christmas.
We'll get busy then too, I'm sure.
So what kind of, on that time, what kind of groups are people call in or for help?
Honestly, most people either call themselves to the crisis line or a family member's calling for them. That's where we get most of our calls from. Of course, we get them from law enforcement and from case managers with the county, and we get referrals from hospitals, but a majority of the time it's usually the client themselves or a family member calling in.
Is it a specific age group, or is it just all over?
We see everybody. I mean, I think the youngest kiddo we've seen is 4 or 5 years old, and we've seen somebody up to, I think, close to 90 years old. So we literally see anybody who needs us. Yes.
Yeah, thank you. Neil, you started the presentation, and I didn't catch it, so I just wanted to ask it again. It was bed days that it was 1,100 and now it's 1,900. What is that specifically, again, just because I missed the details of that?
Sure, those are bed days, so that is per night per person who is staying in a bed for intensive residential treatment services. So those services will be able to be met when our new Urts and Crisis facility opens up locally. Right now, people are traveling across the state, sometimes to other states, to get access to those beds. So I think what we are finding is that it's challenging to find an opening. And so I was actually surprised to see that number jump so high because people are waiting and they're needing to travel for beds. But yes, it's moved from 1,100 bed days in 2018 to over 1,900
for Scott County residents.
For Scott County residents.
And this is the one that primarily, I don't know if that's a safe assumption, primarily Anoka, but I know we have to go here, there, everywhere, but is that kind of the
So
I associate with
it
that?
could be a step down or a step down from Anoka. So typically if people are exiting Anoka, they need a place to stabilize and to get supports in the community when they're ready for that. And so they could be moving down from Anoka. It could be that someone potentially might be a candidate for Anoka, but they're getting their needs met in the meantime, or somebody that we're intentionally trying to provide a service to prevent them from ending up in an institution like Anoka.
And so this is the group that would be, you use the word stabilize, and isn't, again, just clarification here, that the state is responsible for some period of time, and then when they, in their infinite wisdom, deem them stable, then it comes back to the county? Is that?
Yes, so with the Anoka Regional Treatment Facility, the state essentially covers those payments while someone is meeting criteria. When they are determined by the state to not meet that criteria, that is when the county starts receiving bills to pay for that service, which can be around $1,400 a day.
And that's when we're scrambling, there's no option, so
Correct.
they stay where they're at, and county's on the hook, and that's where the IRTs in our guaranteed bed, as I'm looking down at the field, I keep hearing guaranteed bed for Scott County, which will be awesome. So I just wanted to clarify that, and one other, if I may, Madam Chair. Sheriff, with that Vitals app, I mean, when that first rolled out, I mean, that sounds awesome. And so now it's getting the public to gravitate to that. Is that kind of the best in class or the most widely known, or like are there other services like that out there?
I believe that's the only one
Okay.
that does that specific.
And where I'm going with it is, you know, I think, I don't know, Chris asked, are the cities jumping on, like, so that we're not all, oh, you use this service,
Yeah.
oh, we didn't get a read because we were using, so it's basically the only one currently. And how, with the training, how do you feel the deputies with the rollout are feeling pretty safe with that?
Yeah.
It's a great
very,
tool.
Very simple. So basically you do nothing besides initially log up, get this app going, and then it just alerts you, and when the person gets out of that 80-foot zone, the information just falls off. So it's one of those things, you just get a notification. And then we have test beacons that we take to roll call and bring on the office too periodically to verify that it's working.
Right.
So it'll pop up. And
I mean, that's, that seems like this day and age an awesome tool. Cost for end users. So if I'm a client or out in the public, I have to do what?
So they just changed their business model slightly here this month. We found out before that they were giving one beacon free to the clients in the community. Now they let you do the app for free. So if you have a smartphone, the app's free, but any hardware, any beacons are, I believe it's $20 a beacon, something like that, that they'll sell you in their products. So
okay.
I just learned about that last week.
But $20 to get it, not $20 a month or anything like that,
Yeah.
right?
Yep.
Great.
Thank you.
Commissioner Beard, any comments?
Madam Chair, I had two comments. One regarded the discussion around the Vitals app. We just had that. The other regarded the 30 to 60 day gap between calling for help and actually getting help as it appeared from the discussion. You clarified that.
I read your mind
There you go. That's frightening, actually, Madam Chair.
there. Commissioner Howard.
Yeah, I'm looking at something here, and probably you'll know about me, that if we have a topic, I'm sometimes Googling stuff related to the topic, and I did that here. I'm looking at a conference, 19th Annual Conference on Mental Health, put on by the Jewish community in Minneapolis. It's called Creating Health. And what I'm thinking about is, are we speaking broadly and comprehensively enough in our community to health-related issues? What goes into health? How can people manage their health, have a healthy life? What issues could we be speaking to? I mean, depression, anxiety, addiction. I mean, I know there's the aspect of mental health and managing mental health, and there's the issue of mental illness, and sometimes I would guess a mismanaged mental health could lead to mental illness, but other times it's just straight, obviously a biological disease like heart disease or kidney disease, or, you know. But I guess I'm wondering, what can we do in our community? I always hear the faith community saying, how can we speak to issues in our community? What can we do? How could we partner together on issues? Others are Fish is always asking, how can we come together and speak to critical issues of the community. I guess I'm wondering, do we need a mental health conference here with multiple topics, and if you need, people would go to this, and if you need more, like Gary, you've spoken on issues related to suicide and suicide prevention, that would obviously be a workshop or topic in a potential conference. I mean, are we doing that, or is there enough of that already in the community? That's my question. I mean, how can we speak to the whole community on mental health that would benefit us on the back end?
Well, I think for us in social services, I think we really focus on the service component of that. But I think certainly a number of our teams utilize those trainings that are out there to help educate us on that work. So do we need to host something locally? I think that might be interesting to try to engage some of our community members. And certainly any opportunity that we have to spread awareness, I think is helpful. But I think we do have quite a bit of trainings available to us, especially with having the mental health center here. It has been incredibly helpful for our staff in not only our mental health units, but across HHS when we're seeing a need for that. I think you speak to the very clear tie between just overall health and mental health. I mean, I think that is something that we are always exploring new ways to engage our community and to help support our staff in that. So I think that's an interesting idea.
I'm all aboard.
Right, well, we'll maybe explore that.
Well, I know we're about out of time for this matter, but I want to thank all of you, not just for your presentation today, but for the solid work over the last years in making progress on this issue. I think so much of what was talked about today illustrates our fine line between what is the role of specifically county government in this huge issue. How can we help without impeding people's private decision-making rights and dignity and ability to make their own decisions. We've wrestled with those areas, and I feel like we've really set up structures that promote and look for those things. I'm excited about the work going forward, because I see that some of that's maybe even a little bit easier. Some of the work we have to do has to do with awareness and communication of the different parts we have here. Just off the top of my head, I'm like, we really should be marketing or promoting the mobile health crisis team and our mental health centers, crisis, they can meet within 4 hours too, kind of together. Like, here's two options, and nobody cares which one. It's like, can you get in there? You want to go during the day and you don't want somebody to come to your house? You're going to pick this one. You need somebody now, you're going to pick this one. It should be almost marketed together and making sure that we're taking out any artificial lines that we don't need. So I'm really excited to see what can happen there. Excited to see, I think we're really ready now and poised to bring in more nonprofits, more private agencies, and help them help us, help them fill some of these gaps. So thank you, congratulations, and we're looking forward to hearing more in the years to come. So with that, we will recess for 5 minutes for room configuration and get right back to work.
Well, that clearly doesn't work.
I don't know why.
Nope, not the right time. Not the right time. Not the right time.
Reconvene the meeting of the October 15th, 2019 Scott County Board of Commissioners. We're on to item 7 on our agenda, the consent agenda. The items on the consent agenda have been previously workshopped, discussed by our advisory committees, and worked on for some period of time. Unless pulled from the agenda, they will all be considered in one motion. Item 7.1, to authorize amendment number 2 to the Child and Teen Checkups Grant Contract for 2020. Item 7.2, to approve the Minnesota Department of Health Master Grant Contract for Community Health Boards. Item 7.3, to adopt resolution number 2019-144, authorizing entering into a contract with the Board of Water and Soil Resources for the 2020 Natural Resources Block Grant in the amount of $143,120. Item 7.4, to adopt resolution number 2019-145, authorizing final payment to Egan Company for the County Highway 83 Traffic Management System contract in the amount of $27,612.38. Item 7.5, to adopt resolution number 2019-146, authorizing annual agreements with Foster Appraisals Incorporated and Kelly Lindstrom for appraisal review consulting services. Item 7.6, to approve record of disbursements and approve claims. Item 7.7, authorize staff to issue a solid waste license to Lloyd's Construction Services Incorporated at 6528 County Road 101 East in Shakopee, Minnesota. Item 7.8, to approve the final plat of Lake Estates, Thompson Land LLC applicant and property owner, consisting of 16 lots and 1 outlot on 75.32 acres in sections 19 and 30 of Credit River Township, 3-way development agreement and conservation easements. And item 7.9, to approve payroll processing of personnel actions. Does anyone feel a need to remove any items from the consent agenda?
Madam Chair, I'll move approval of the consent agenda.
It's been moved and seconded to approve the 9 items on the consent agenda. Any further discussion? Seeing none, all in favor, please say aye.
Aye.
All opposed, same sign. Motion carried. Well, now we're on to I guess I was going to say a happy matter, but it's kind of it's a very sad matter for us, a happy matter for the retiree. Recognition of Scott County retiree Paul Nelson. And as Commissioner Beer gets ready to speak, I am with bittersweet always to recognize our retirees, to recognize the work that they've done, and to wish them well as they go on to do new fun things. So, Commissioner Beer.
Paul, come on up. Come on up. This was a guy, when I first came online, I didn't know this guy from Adam. Come on up here. I said, and I work with the watershed as a liaison, and I said, Paul, he's going to retire soon. Who's Paul? And then I met Paul, and I said, are you going to retire soon? He says, well, if they tick me off 3 times in 1 week, then I know it's time. It was just good jest. That's all it was.
True story.
So I said, how are we doing this week? Only two. Well, here we are. So we must have hit that threshold just in jest.
Leslie, you didn't do anything.
Yeah, he kept saying it was me. All right, here we go. Oh, and by the way, I'm always amazed that we can encapsulate, a career down into a page or 2. But 4 pages. But look at that font. I don't know, maybe that's because of my reading, but probably just a routine emergency. All right, here we go. Paul Nelson started working for Scott County in 2006. He stepped into this job with a good understanding of our geography and water resources, having worked several years as the administrator for the Prior Lake Spring Lake Watershed District before moving over to the county. And boy, have I got stories about that. No. Just kidding.
Me too.
That'll be for the after. We'll talk about that for the after. Much of Paul's career was in the private consulting world, and in his first few years on the job here at the county, he quickly identified ways to focus the Natural Resources Department into a data-driven, project-oriented team of professionals. He also stressed the importance of partnerships, as evidenced by the folks in this room today. It goes to show the level of effort Paul put into building those relationships. He never stopped, you never had a problem with spending other people's money. I got to make sure we put the quotes in that, other people's money, and leveraged his close relationships with agencies like Bowser and MPCA to help bring in funding and technical assistance to address our natural resource challenges. One major grant Paul helped secure was a $2.2 million targeted watershed grant to to fund projects in the Sand Creek watershed. Under Paul's watch, the county's working relationship with the Scott Soil and Water Conservation District was strengthened to the point where Paul could say his staff could do the planning, science, and the CIP projects, but the SWCD are the boots on the ground. This close partnership with the SWCD resulted in over 800 cost share projects completed during his tenure. 800. It's a lot. Those are 800 real-world examples of landowners wanting to do the right thing to conserve the land or soils or protect the water, and thankful folks like Paul and the county and SWCD staff were there to lend a hand. In addition to these 800 touches on the landscape, Paul also oversaw the completion of 11 capital improvement projects, ranging from 2,000 feet of ravine stabilization, 100-foot bluff stabilization, which wasn't that the one you tried to kind of, hey, get a little closer so you can see, to infiltration basins in our county parks. We're still wondering about that. One important legacy that Paul leaves us here at Scott County is the delisting of 2 water bodies from the state's impaired waters list, McMahon Lake and Credit River. While Paul might be too modest to take credit for these headline-making announcements that these lakes and rivers were no longer impaired, many people who work with Paul know that it was his diligence to targeted conservation practices and long-range plans affecting these water bodies that helped move the needle toward improvement. Thanks for doing that. Anyone who knows Paul knows he is a reluctant regulator. It should be a bumper sticker or a t-shirt. The reluctant regulator. Across his career, Paul recognized that rules and regulations handed down from the government would not affect change on the landscape. Rather, Paul knew the real change comes when the individual landowner is inspired into action. Paul used this philosophy when he co-wrote a book with the SWCD district manager, Troy Koopfall. Did I get that right? And a UM professor, May Davenport, titled Inspiring Action. So Inspiring Action draws upon decades of Paul's experience with engagement in conservation management and years of applied research on conservation behavior. The book's guiding principles for inspiring conservation action not only are backed by the latest social science, but also have been field tested here in Scott County. In the past 5 years, Paul's role in the organization expanded to take on the management of programs and staff working on environmental health, solid waste, groundwater, septic systems, my personal favorite, and household hazardous waste. Paul enjoyed taking on these new programs and instilling into staff his data-driven, problem-solving, practical approach to these topics. Major accomplishments in this role include completing the 2019 solid waste plan, overseeing the $1.5 million expansion to the household hazardous waste facility, and moving legislation that allows our county to be more flexible using solid waste grant dollars. That was in the last 12 months, wasn't it? That was pretty recently. After 13 years here at the county, Paul is retiring. This should give him more time to do the things he enjoys, and this has to be an error. This should give him more time to do the things he enjoys, like bank and ravine stabilization. You're going to be doing more of that? Oh, wait, no, like biking, canoeing, hiking, and making great maple syrup. Yeah, I thought that had to be an error. So canoeing, hiking, and making maple syrup. We understand this is the longest tenured job Paul has ever held, and we are fortunate for that. We are so glad you found a place to practice your passion and instill your philosophy and conservation ethic. You have made a lasting impression on our organization and landscape. And for that, we want to say thank you and congratulations. Thanks for all your hard work. We're going to do a So now we got your PowerPoint and 14 minutes of presentation.
He's going to show us the 800 projects.
Exactly.
That doesn't count the capital improvements. I want to say thank you. This was a very good fit for me in my career. I spent a lot of the first half of my career on the private side and traveled a lot around the country and even a little bit internationally to do work, and that drains you. And coming here, it's been very comfortable. And a few things I say to staff, and these still hold true, is the board has been very good to us. And I very much appreciate the trust. And this team, a lot of folks here are part of this team, deserve that trust. It's not just me, it's a larger team effort. And as part of that, I said that the key to earning that trust to my staff is not to be the headline in the newspaper. The board probably doesn't appreciate that too much. So for the most part, I think we avoided that, and I appreciate your trust. And also, Melissa, thank you so much she's been here, I think, 1 year before me. It's been fabulous. Cindy, yeah. Jason, thanks for coming today. It was great to work with you. Richard, you don't have to worry about reminding me of scene articles anymore. And our SWCD partners, it has been to the point, this partnership, where our staff just acts sort of interchangeably. And that's been really wonderful. So thanks, everybody. And you have a great team that's still here, and they'll do well by you. And thank the board.
Thank you, Paul. Thank you. I know we have other partners, staff, and residents here, so if anyone else would like to approach the podium and say a few words on this occasion, please do so.
I did want to say one more thing. Joe in the hallway, you're going to have to find someone else to give you fun projects.
Kate.
We gotta come over here so I can talk to you. I'll be quick. Paul, congratulations on all of your many accomplishments. It took a lot of hard work and dedication, and I just want to thank you for that. It took a lot of meeting with people in the field, in the office, in the evenings. You were doing a lot of catching up with work on the weekends, taking a lot of time to stay on top of those issues, to protect Scott County, providing a vision to the department and helping us staff reach our goals. I want to thank you for agreeing to manage the Environmental Health Department 5 years ago. That is, you must love challenges, because that meant on top of your already full plate, you took on 5 programs and 10 more staff. And those programs, along with the natural resources, environmental health, bringing that department together to create environmental services, all those programs continue to grow and improve. Lastly, a personal thank you. 5 years ago, I became a supervisor when you hired me. And then you started teaching me the ropes of what it meant to be a supervisor. So we spent a lot of time talking about budgets, performance reviews, how to work with a board, how to build partnerships, and working with different communication styles. And a little tip on how we work through our communication style, and a lot of the staff here know, I had to learn a new skill, which I'd like to just quickly show everybody. So my communication style is to bullet point, email to Paul, ask him to just quickly look it over and track changes that back to me. No, that's not Paul's communication style. He prints it, and then he writes in cursive in a circle all around, so I had to learn how to do that. I would have staff come over and ask me to please, what does Paul want? Excuse me, here's another example. You see he has arrows where you have to follow what he writes, then follow the arrows around the page to the back. You guys had that before? And then he either puts it on your chair or slips it under your door, and then you pick it up and you're like, oh my goodness. So anyways, I'm really gonna miss some of the fun, creative comments. You're a free writer, and that's fun. Anyways, I'll just end it with, you often say to us, you're just the water guy, but speaking from all of us, you're so much more than that to all of us at Scott County, and we're really gonna miss you.
Thank you, Kate.
All right, I want to say a few words about Paul as well. Paul and I came to the county about the same time, and I quickly learned how he was a good fit for the county, a good fit for our overall philosophy of how we manage growth and development while still balancing the natural environment. And Paul always kind of approached that issue real practical, and I always appreciated that. Anyone who knows Paul knows he's a scientist. He'll tell you that. often. I'm a scientist, and he immersed himself in data and graphs and would talk about runoff coefficients and just loved the data before we all thought it was cool and started calling it Delivering What Matters. Paul was doing it 10 years ago. But very practical. I remember at times we would talk about a tricky drainage issue or kind of a challenging topographic issue, and Paul would just look at me and say, you know, water does run downhill. And it was good advice. It was something that you just keep reminding yourself that that is what you're dealing with. Water is running downhill all the time. So one of the first projects Paul and I worked on back in probably 2007, 2008, with a lot of people in the room here, was identifying greenway corridors, what we call natural area corridors, for the first time. We got a lot of stakeholders together, identified our unique and critical natural resources, started putting them on maps. And I remember one day sitting down with Paul, I wrote out a map of these greenway corridors crisscrossing the county, and I looked at Paul and said, how are we going to protect all this open space? And Paul said, we are not, emphasis on we. That is not the government's role to preserve all this open space. Instead, let's work with the landowners and really incentivize them to protect these corridors. And again, that was just another example of his philosophy. It's not the government's role to do all these things. It's really encouraging the landowners to do the right thing. Another memorable project was the detailed area plan. This was looking at kind of the full build out of the 4 eastern townships with 2.5 acre lot style development. And we looked at a range of impacts from transportation to natural resources. And Paul mentioned to me once, he said, you know, this development pattern will actually improve the water quality in this area. We're actually going to see improvement on Credit River and some of the water resources. And it just took me by surprise, because growing up in the planning profession, we learned that rampant housing development in the countryside is going to be major impacts on the environment, and it's something we really need to mitigate. And Paul said just the contrary. You know, a lot of this ag land that has a tendency to erode and get into these water bodies, that land's going to get converted into lawns and grass, and we're going to see less erosion in these water resources. And so it's an example like that where Paul would just kind of stop you in your tracks. When you thought you kind of knew everything, he would approach it from a different way, and he would start talking about the data and just catch you by surprise. So for that, I've always appreciated Paul's advice. He's someone I'd go to quite a bit, even if there are issues not related to water. I knew I had someone that would really take a look at things, be even-keeled, practical, and really wise too. So for that, Paul, I appreciate everything you've done for me and for the organization. Thank you.
I think that Brad stole my line. You know, sometimes people say things that you hear and you get used to hearing. In the past 10 months, I have missed, I'm a scientist, you know. Every functional lead meeting, which was probably my favorite set of meetings for the last 10 years, was I'm a scientist, you know. And it just sticks home with me of how important that was in his thinking and what he has brought to this organization. His approach for landowners and business and for the county to get us to engage and to participate, and that it wasn't a law, it wasn't a statute, it wasn't a rule, it was the outcomes that mattered, and convincing folks of that and that mentality and that everything we do. His willingness to talk about, it's really hard to measure what you've prevented when we're looking at some of the things that we do and the importance of that. And the other thing was his willingness to step up when Al left, right? A long-term manager, a lot of kind of fear, I think, about what was going to happen. Paul steps right in to take this over, and he's sitting in one of the first meetings about the complexity of their funding, and he just about 8 months later made my heart melt. He walks in with this graph and these projections on where they're going to spend it and how they can spend it, and simplified the whole thing so I could follow it, on what he was going to do with the household waste and this fund and that fund, and empowering staff to be able to do these things, and how we were going to operate into the future. Such clear planning and such clear vision that I know he's empowered the rest of his staff to do and to carry forward. And I personally miss our chats and your adventures, kayaking and canoeing and national parks and everything we used to chat about. And you've changed the landscape, you've changed philosophies here, and really appreciate everything you have done and just wish you the best.
with that, we'll recess for 15 minutes and share some more stories, have a
Wait,
reception.
you've got-
Oh, there's more, come on.
Speaking of
Yeah,
more
come on,
stories.
more, yeah. The attorney just came back after being sent away. So I'm like,
Sorry I didn't jump up
No,
fast
yes.
enough. For those who don't know me, my name is Jason Swenson, and I was the water resource engineer here at Scott County for about 11 years. I left in 2017. And when I came to Scott County, Paul was not here yet. He literally started a couple days after I did, and when I was hired, I was told, "We think you'll like the manager who we're going to hire for you." Boy, were they right. Really cherished the relationship I had with Paul over those 11 years. I'm not overemphasizing this when I say he's the best manager I've ever worked for in my career. More recently, I've now become a supervisor myself, and I emulate many of the things that I do in my world after Paul. Paul's, I don't want to say, his impact will reach far beyond Scott County as well. I now work at MnDOT. Other employees from Scott County have moved on and gone to places like the DNR, the MPCA, and the reluctant regulator tag is very appropriate. And it's something that, how shall I say it, you find that it's not a common thought amongst many regulators out there. And the practicality of how Paul approached the work and regulating and working on that can't be overstated. So again, Paul, thank you very much for your impact on me as a person, my career. And I just very much miss the chats that we used to have on like a weekly basis. Those chats, whether they were work-related, personal-related, vacation-related, all those kinds of things. Those are memories I'll cherish forever. Thank you.
Thank you.
I know you want to recess, so I'll try to be brief. So as Paul mentioned before, I had been here for about a year when Paul got the job as Natural Resources Program Manager and the Watershed Management Administrator. And back then, it was just Paul, Jason, and myself. We had a really small staff. And also when he came on, we had just finished our first generation plan, which is basically creating rules and standards. And not a whole lot was happening. And when he came on, we created the second generation plan, which had everything to do with implementation. And this analogy has been said about one other person who left this county, but I think it truly fits Paul as well, is we were going along as an organization in like a rowboat. And when Paul came on and we did that second generation plan, he put a 4-stroke motor on that boat, and we've been going full speed ahead ever since. I don't ever remember a dull moment with Paul in the driver's seat. We've had so many projects going on at one time for our small staff. We actually used to meet every 2 weeks and make a punch list. And we'd make a short-term list and a long-term list, and that long-term list stuff would get moved over to that short-term list. But it's been great. I've loved the variety, and I've loved being super busy. And we've got a lot done in 13 years. A lot of projects and a lot of measurable improvements so far. I've had other bosses in the past who gave orders, but Paul always gave us direction. And I've had other bosses who've led by authority, but Paul's always led us by respect. You've created such a positive working environment where everyone's opinion matters, and you gave us and this organization a vision. You've been such an integral part in my career and my professional growth. You are a wonderful teacher, boss, leader, and friend. And you're everything one should look for in a good mentor. You've groomed us to be sound scientists and professionals, and you made working with you an interesting, fun, and memorable experience. I truly appreciate and value everything I've learned from you, and it will forever remain a major contributor behind any of my future successes and achievements. And I look forward to being able to do that for someone else someday. So I want to say thank you for being less of a boss and more of a leader and a mentor. And I'll always be grateful to you for your support, understanding, and kindness. You'll truly be missed.
First week I was here, Melissa came into my office and said to me, you know, we need to name a feedlot officer. And my first thought was, ooh. And Melissa said, well, you know, I was that in Rice County. I didn't necessarily enjoy it, but I said, job's yours.
For the past 13 years, Paul has served in the environmental department for Scott County, and I've been fortunate enough to have Paul as my direct supervisor for 5 of those. As Paul's leaving, I thought what I would do is actually share some of the things that I'm going to miss most about Paul. Paul said that he worked on the Cayuga River, which started on fire in 1969. Fortunately for us, none of our rivers are polluted enough that the waters turn flammable. However, they've had their own set of issues, and it's a fact that Paul gets to leave knowing that he has had his part in the delisting of 2 waters, as Commissioner Beard stated, and also our runoff and sediment reduction numbers are trending downward. As Paul would say, the proof is in the pudding. Paul is one of the smartest people I've ever met. Anytime I feel I have a good grasp on anything water resources related, Paul can humble me. With a simple conversation, I'll go to his office to talk about a program, and we'll get on the subject of runoff reduction numbers. My face and eyes glaze over. I start nodding, and Paul knows that I have no idea what he's talking about.
But I don't stop.
Google searches after meetings with Paul have served me well to see what he was talking about. Time. He always makes time for people. I've never gone to his office and he's turned me away, and that goes for all staff. I probably abuse this at times as well, as Paul's frantically trying to get his timesheet done. And he has that same glazed over look on his face, like how can he be here for the 10th time asking me a question this morning? My timesheet was due a couple hours ago. But the thing I'm going to miss most about Paul is his leadership. When Paul speaks, people listen. He has the ability to influence the masses, in his philosophy and direction to our focus of our programs to social aspects rather than the science, has built a sustainable culture that we will continue to carry on. Paul sees the forest through the trees and knows how far we have to go, but because of Paul, we are that much closer to reaching those goals. The residents of Scott County will miss Paul the environmentalist for all the work that he's done, but internally we will miss Paul the person for everything that he has taught us. There's a saying that you never truly appreciate something until it's gone, but that's not the case with Paul. I was appreciative every day that I was able to work with him. I guess when given the chance to spend my time biking, making maple syrup, or reading books, or getting hollered at why it doesn't stop raining, I would choose the former too. Best of luck with all your future endeavors, and when your passion runs as deep as Paul's does for water resources, I know our paths will cross again. Thank you.
Any other comments from the audience?
Madam Chair, I was just going to make a couple comments. The first time I met Paul or saw him, I thought to myself, first of all, is this the guy who makes the commandments for Scott County? And no. But then the last time I met with him last week, there's some people that want to make a ditch out in Newmarket Township. And so I mentioned that to Paul, and he's like, oh, well, you're going to have to get Bowser. And, I'm like thinking, oh, let's get this by next Thursday or whatever. And he's like, no, Bowser and DNR and the counties and WMOs and all this stuff. And I'm like, okay, well, is that Friday? So he is the reluctant regulator. Anyhow, I don't know if it's still on track for Friday, but thank you, Paul.
Any other comments? All right, Paul, thank you. So much of the work we have to do with as a county is reactive, is sudden, is impacting people in the here and now. And so much of the work you've helped this county do is really for the future and for building the legacy of this county for the long term. And so thank you for taking that so seriously and educating and helping the rest of us get there. We'll miss you very much. So now we'll recess until 10:15 for a reception next door.
County Board of Commissioners. We're on to item 10.1, and County Attorney Hocevar is going to get us started.
Good morning, Madam Chair, Commissioners. We're here to talk about Vets Court this morning. As you know, with your support and acquiescence, we applied for the grant to start a formal Vets Court here in Scott County. We have kind of had a informal Vets Court going with Judge Wilton's leadership on that to get that going, but now we're on the road to make it a formal Vets Court and really get the ball rolling. With that in mind, I have members of my staff here to fill you in more on the details of that. I've got Tori Hyder here, Bryce Ehrman, and Alan Anderson, who have been vital in getting this going. And also, of course, the Honorable Judge Christian Wilton is also with us, and he will address any questions and fill you in on the details of that also. So with that, I will turn over to Alan.
Thank you. Good morning. Thank you, Madam Chair and Commissioners. Veteran involvement in the criminal justice system has become an epidemic in our society. More than half of veterans who become involved in the criminal justice system suffer from mental health problems, such as post-traumatic stress disorder, depression, and anxiety, as well as substance abuse disorders. Substance abuse disorders often occur in these veterans because they're attempting to self-medicate their physical and psychological wounds. Minnesota has not been an exception to this national issue. In this state alone, veterans commit suicide at a rate 10% higher than the general population, despite the fact that they only make up 6% of the population in this state. And this problem also applies to us here in Scott County. In our informal docket, when we applied for our grant, over 30% of our participants reported homelessness, and over 50% reported homelessness, and over 30% reported no current employment. After this need was realized in Scott County, and it was realized that our veterans needed help, the decision was made to explore forming a veterans treatment court to provide services and support for these men and women. In November of 2018, our informal docket began meeting. By May of 2019, our docket was already over capacity and we had to begin turning away potential applicants. At this point, I'm going to turn it over to Tori Hyder, who's going to explain how our current program has run so far.
The current operation meets once per month on Monday mornings. Prior to each docket that meets on the Monday mornings, we have a team staffing, which occurs in the Scott County Attorney's Office. The team there reviews progress updates, they discuss treatment plans, and other participant-related matters. At each docket, the judge interacts with participants regarding their progress in the program since the prior docket. They address concerns, provide encouragement and support, and impose sanctions when necessary. Right now, we are filling the current gap through the generosity of all of our team members who have volunteered time from their already packed schedules without any added income or incentive. Our veteran justice outreach coordinators are Margaret Newman and Matt Harris, who have been imperative in this process. They make the drive from their Minneapolis offices to Shakopee for each staffing and docket meeting to provide updates on benefit receiving participants on top of their other treatment court caseloads in other counties and their other veteran justice outreach duties. We also have our first judicial public defender, Michelle Barley. She, in addition to her drug court clientele, has taken on 20-plus clients for our veterans docket. Both Judges Wilton and Lennon have both added calendars, staffings, and veteran-related matters to their busy schedules. The County Attorney's Office, with the blessing of Ron Hocevar, has been impacted by allowing Bryce Ehrman to stand in as prosecutor, as well as Alan Anderson and I working far beyond our daily job responsibilities in organizing the current operation and tirelessly co-navigating the complex art of applying for a federal grant opportunity of this level. In addition, we have gained hours of support from Scott County Veteran Services, court administration, and other entities. Moreover, without your initial support, the board's initial support, this would not be possible at all, and we are very thankful and fortunate for that. We're awestruck also by the support of our community members and our veterans' loved ones. For example, in one instance, one of our participants' significant others volunteered her weekday to drive 2 in-custody veterans from Scott County Jail to St. Cloud for inpatient treatment to fill the need for that. We've also garnered 2 to 3 mentors thus far who have aided in supporting participants. And with additional funding and training, we feel optimistic about our community's ability to gain additional suitable mentors. Now Alan will discuss how this funding opportunity will influence our future operations.
As I mentioned earlier, thus far we have been operating in an informal manner in our Veterans Court. Our hope by securing this funding is that we can make it a more formal Veterans Treatment Court. Our number one priority with this funding will be to hire a court coordinator and probation officer. Intense supervision is one of the most important principles in a treatment court, and thus far we have not been able to supervise our participants appropriately. Bringing in an individual who serves as both the coordinator and the probation officer will allow us to have a team member who is dedicated to serving and supervising the participants in our program, which will allow us to conform with the national best practice standards for treatment courts. Another important standard funding will allow us to comply with is drug and alcohol testing. It has always been the policy of our docket that our participants are expected to refrain from alcohol and non-prescribed drug use. But unfortunately, we have not had funding to this point to regularly test our participants. Additionally, many of our participants cannot afford to pay for the tests themselves because of the high unemployment rate of our participants. Therefore, we have not been able to screen our participants for that alcohol or non-prescribed drug use. This will be an important tool in our treatment court because it will allow us to intervene and treat the chemical dependency issues as we can catch them. Another important step we plan to take is to take our entire team to training events. Some of our team members have attended treatment court training in the past, but we will be attending Veterans Court specific training as an entire team together so that we can ensure our policies are in line with national training standards. Although our policies and procedures are still in the process of being created, we do have some general guidelines that we hope to follow as we establish this court. The first of these guidelines is eligibility. Our court plans on accepting any current or former military member, regardless of their discharge status or their VA healthcare eligibility. But it is equally important to our team to ensure that the Veterans Docket serves Scott County first and foremost. All of our participants will be required to have a significant nexus or connection with Scott County. These connections may include residency, employment, victim residency, or other factors that will be taken into consideration, but every participant will be required to have a significant connection. Our team has not chosen to implement a residency requirement in our court. We have several reasons for this. The most important is that many veterans enter our program while homeless. If they become housed through a VA-run program while participating in our court, we would not want to have to terminate them simply because they achieved housing. For example, in our program currently, we have 3 veterans who, when they entered the program, reported being homeless and who have since received housing vouchers through the VA and now have housing in Carver County, Dakota County, and Hennepin County. While securing housing for these veterans was an important step, they're not yet ready to be discharged from the program. If we were to impose a residency requirement, we'd be required to discharge these veterans as soon as they are placed in appropriate housing. Finally, the vast majority of our participants use VA services, not county services. So a residency requirement will most likely not place any additional burden on Scott County services because they will continue to use the federal services that they have earned. And once again, I will turn it over to Tori to make our request.
We are asking the board to adopt resolution number 2019-148, which is authorizing the acceptance of fiscal year 2019 adult drug court discretionary grant from the Department of Justice in the amount of $500,000. At this time, We are requesting that the board sign off on the federal grant acceptance letter. In doing so, the board accepts the condition to provide match funding of $41,665 to the yearly budget over the next 4 years. The acceptance letter is necessary for release of federal grant funds to Scott County so we can continue in this implementation. Thank you. And then Judge Wilton has some things he would like to add as well.
Good morning.
Good morning.
Thanks for having us. What Alan didn't tell you was he's a recent bar admittee. So he passed the
just in
bar.
the last couple days.
Yeah.
Congratulations.
These two have worked tirelessly on our grant application. I'm not sure if we combine their ages that they would meet my age, but they have put together a federal grant that has been approved, and that is no small task. I want to thank all of you for meeting with us a number of months back and agreeing to give us that first step and that money to go ahead and make this grant application. I have been on the bench now for 7 years this month, and during that time I've handled thousands of cases. I don't keep track, but people come in and people go out, and you try to move your calendar. Many of you have come to see graduation in treatment court, and we spend time and effort and get to know people. But on the general calendars, that's almost impossible. This morning, I think there were 17 or 18 people on the jury trial calendar alone. There's an omnibus calendar with 30 on it, and so we move bodies. We are in the business of moving bodies. Doing justice is the best we can do, but we move bodies. From time to time, I get veterans in front of me, and usually the dead giveaway is, "Sir, yes, sir." And then I realize that he or she is a veteran. But they don't dress different, they don't wear their uniform in, and so they come and go. If you asked me a year ago, how many veterans have you seen in Scott County, I would probably tell you a handful. Yet I know now that many were veterans that came in front of me, but they're invisible because either they didn't say anything to me or I didn't ask the right questions. That's on me and not them. It's so easy to move through what we do without paying attention. When I was walking over here, I noticed a small monument right out front of this building. And I've probably passed it 100 or 200 times. And I assumed it had something to do with the military. We got our flags and everything else. So today I stopped and took a look at it. And it's marble, and it says it's dedicated to the veterans of Scott County. And it has a quote listed on this marble statue. And it says, "The cost of freedom is always high, but Americans have always paid it. And one path we shall never choose, and that path is of surrender or submission." And that was a quote from John Fitzgerald Kennedy, JFK. Seems to me that we honor our veterans with a small placard, and it's beautiful. And we do that to remember all those people that have given so much for us. We've paid homage for what they have done for us. And now it's time to pay homage in a material and a tangible way, to help those that have helped us, to help those who are willing to make that ultimate sacrifice, and frankly, to help those who are in need. They sign a piece of paper, they go in the military, they fight, we sit at home. For those that have loved ones who have done that, I can't imagine the angst of being a mom or a dad. With this grant, and hopefully with your approval, we are way past due to do something for our veterans. And to me, at least, this is the least that we can do for the people that have done so much for us. We have a lot of work to do, assuming you sign off on this. There's a 3 or 4 day training. We have to get our bylaws together. We have to talk about who we're going to accept and who we're not going to accept, etc. But it was humbling to show up in a courtroom where nobody thought there were veterans in Scott County and see over 20 young and old. We have Vietnam veterans in our Veterans Court. We have some 20-somethings in our Veterans Court. And when you sit and listen to these individuals, these human beings, and what they've gone through and what they're adjusting to now, it's humbling. It's humbling to stand in front of them knowing what they've sacrificed. And, you know, yes, we've done a lot of hard work. We've added some calendars. But really, in the big scheme of life, they've done the work. And so I'm proud to be part of this. I'm proud and humbled to stand before you and before them every Monday or once a month to talk to them and to try to move them forward. With this grant, you are going to provide services that are unimaginable. I mean, we talk about probation department, we talk about drug testing, housing. People have stepped up. The greatest thing about this event and this 11 months that we've been doing this is nobody's getting extra pay. Everybody gives up their lunch, their early mornings. The public defender, the VA, the county attorney's office has dumped tons of resources in. And it's all for the right reason. And that's a rare occasion where you see every justice partner coming to the table, not saying, what's in it for me? It's, what can we do? So this is an amazing project, and I have no doubt that this will be as successful as our drug court. Happy to answer any and all questions. Happy to have you address any of the members with any questions.
Thank you. Very good presentation by all. Comments? Commissioner Beard.
Madam Chair, thank you, and Judge Wilson, thank you for helping see that this happens. We've seen the success of the drug court to this point, and I wondered if we couldn't do something with the veterans. Our family is walking this path with our Marine right now, just doing stupid stuff that leaves us completely baffled, because when he came home from the Corps, he was different than the kid we raised, and that's just the way it was. Don't understand it, but know that they mean well. They're committed to their country and their Constitution, but there's something going on in their soul that I think they need extra help in figuring it out, getting their feet back on the ground. It's way different than the guys who came home from World War II, different than Vietnam. I don't understand it, but I witness it in my own existence. So I'd like to make the motion when it's time to do that. But before I do, one question. You're asking this board to commit to 4 years of about 40-some thousand a year, which if I'm here, I will do that in a heartbeat. The 500,000, does that extend for 4 years as well, or is that just for this year?
That's 4 years.
That's
so
a 4-year grant.
That's be 4 years in total. I think the county would be on the hook for about 166,000 and change.
Yeah.
And then the 500,000 would be over 4 years.
Wow. Marvelous program. I'm happy to support it.
Thank you.
Go ahead, Mike.
Madam Chair, I will. I'll make the motion to adopt Resolution 2019-148, authorizing the acceptance of an adult drug court discretionary grant from the U.S. Department of Justice in the amount of $500,000 and not urge its adoption.
Thank you.
Second.
It's been moved and seconded to adopt resolution number 2019-148. Further comments? Commissioner Wolf.
I think it's a great program. I think it's long overdue, so thank you.
Thank you.
I'm compelled just to make this clarification. Our son is not walking that path in the Scott County court system. Just let me be very clear about that. This isn't another part of the state that I have no personal influence over. So it just occurred to me that I better put that on the record. Thank you.
Thank you for that. Any further comments or questions? Yes.
Can I just add one thing, Madam Chair? You know, I'm usually a pretty big process person and following process, but I have to say, Alan and Tori came up to my office like the day this grant was approved and handed me this contract and wanted me to sign it. And they were talking about the good things we were going to do and the enthusiasm that they had for this program and the difference it was going to make. Deb was there in my office with me, and I am so proud of the young staff that we have around this county that want to do these things, and the energy and the passion that they are bringing to what they want to do. I almost wanted to sign it. I had to say, I can't till the board takes action, but they almost compelled me to sign it. They were so anxious to get going, and so congratulations.
Thank you.
Thank you for that. Any further comments or questions?
If it prevails, I suppose we should recess and celebrate. I think there's probably still something in the next room.
2 for 1.
All in favor of the motion, please say aye.
Aye.
Aye. All opposed, same sign. Motion carried. Thank you
so
very
much.
All right, on to item 10.2, adopting resolution number 2019-147, and Ryan Holzer is presenting.
Madam Chair, Commissioners, this resolution is awarding a contract to Sunram Construction Incorporated for our Sand Creek Near Channel stabilization project. This would be the Phase 4 project. It's located in Helena Township in the amount of $180,244. This project was identified through a feasibility study plus multiple other studies that have found that Sand Creek is impaired for aquatic life and is high in sediment. This project is designed to reduce sediment to Sand Creek. Funding for the project is proposed to come from three sources, one being a $2.2 million grant through Bowser, which we were awarded, and that grant actually expires in March of 2020. Another grant, which is through MPCA, and that was for EPA funding. That grant expires in August of 2020. And so this project, the timeline for construction is that the contractor is supposed to have substantial completion of the project done by February to give us enough time to use the Bowser funds in an appropriate time frame. And then restoration of the site would occur afterwards because it's difficult to restore a site in February in most years. And that's where we use the EPA funds to do the restoration. The third funding source then would be the WMO with our special taxing district, and that is within the 2019 budget. We received, and there is one change here to the RBA, who actually received 6 bids. So at the time that this, the bids came in, there was a technical issue with one, which we did resolve. We are saying that that was another bid that we received, and that was for, from Minnesota Native Landscapes, and that was for $275,370, which would put them at the third lowest bid. So it didn't change who the low bid was, but we do want to recognize that they did submit a bid, and we did accept their bid. So bids came in last Thursday. We're trying to turn this around as quick as possible to give the contractors as much time to construct the project, just because they're working in water and it can be difficult depending on water levels, and then obviously ice is coming before we want it to, maybe a lot of us, but so that's why we're kind of turning this around in a quick manner. The landowner is dedicating all easements for the project, so we aren't paying for any of those. And with that, I will stand for any questions.
Well, thank you. I'm sure we're going to have a question here. Is Commissioner Beard, are you going to ask the question we're all wondering?
Yeah, probably. Ryan, over the last couple of months, we've had some amazing bids come in that have come apart once we said, sign here. I can think of 3 of them in particular, and I'm looking at the spread that you're showing us here. That's a pretty remarkable spread. How can you speak about the confidence level your team has in this actually being accepted and being done?
Yep, Madam Chair, Commissioner Beard. So, and I should have, it's a good point that I failed to put in here. This bid is actually $120,000 under the engineer's estimate. So it's a little bit of a unique project because unlike maybe a lot of other construction projects, most of the material is actually coming from on-site. And so they're not having to haul in from a third-party source. The trees that they're going to use to construct these log jams actually come from on-site. So the landowner is allowing us to use those trees. No additional compensation to them. The dirt that they'll use to actually backfill some of these jams, that comes from on-site as well. They do have to haul in some material like boulders and surface treatment, like erosion control blanket and seed, which are fairly minimal cost to the project. We did, as part of this, we do require references, and so this contractor was required to submit 3 references of past projects that they've done of similar scope. They submitted 29 references. I did not check all 29, but what it shows is that they've done quite a bit of work that is similar to what we're proposing. I did ask some of these references, and some of which we knew. You know, we've worked with them ourselves, they're partners, and so there's a level of trust there. And they felt confident in Sunram in that they would perform to the kind of level of expectation that we have. And so based on references that we've checked of previous projects, even though this did come in quite a bit under, we do feel confident as though we can work with the contractor. And one big thing that they'd said is that they're flexible. And with this, it's a field set item, and that's a big part of it is flexibility.
Thank you for the
Thank you.
question and the explanation. Other comments or questions?
Madam Chair, I'll be happy to move this resolution also, Resolution 2019-147, awarding the contract to Sunram Construction for the Sand Creek Near Channel Sediment Reduction Phase 4 project in Helena Township in the amount of $180,244.
Second.
So moved and seconded to adopt resolution number 2019-147. Any further discussion? Seeing none, all in favor, please say aye.
Aye.
All opposed, same sign. Motion carried. Thank you,
Thank you.
Ryan. All right, now we're on to committee reports and commissioner updates. Commissioner Wolf, would you get us started?
Thank you, Madam Chair. On the 1st of October, Newmarket Township had their monthly meeting. On the 2nd, Cedar Lake Sewer had their meeting, their every other month meeting. We're noticing that costs are going down there because we have been buying better pumps. And, yeah, you wouldn't believe it, but they just take a lot less maintenance, a lot less money. They last more years. So it's very nice. Also, they have to move one of their lines because of the roundabout out there on 15 here in the next few months. On the 3rd, I was at Sand Creek Township. They, one of the big items here was there's some folks that would like to put up some solar panels in Sand Creek Township. Then on the 7th, the Public Works lunch. I helped serve lettuce, and I'm very good at it. A lot of people don't like tomatoes. So they would sit, they would take the tomatoes off their plate, so it was kind of funny. Anyhow, then on the same day, the Prior Lake Spring Lake Watershed Tour, saw a lot of nice projects. Ray Sandy, we used to go to their house as kids, and 4th of July, Memorial Day, and never realized what a nice piece of property that is. Till we saw this tour. I think it's been 30 years since I've been there, so very nice. Prior Lake City, they have some policy changes that they're working on. They haven't changed in years. Then I went to Credit River Township and then Cedar Lake Township for their monthly meetings that night. On the 8th, I was out at Public Works and just to have lunch for the Appreciation Week there. Later on, I met with Highway, one of the engineers there to find out about some of the road projects and when they're going to be done, when they expect them done. They said if I could tell them what the weather was going to be, they'd have a better idea. So it's lots of rain this year. So, but 13 and 21 sounds like at the end of this month should be end of October should be opened up. The 21 portion, the 13, the state part, they don't know about. So, on the 9th, the Metropolitan Emergency Service Board met, the MESB. On the 10th, the I-35 Solutions. We were going over our legislative agenda and what our top priorities will be for the legislative session in 2020. Later that afternoon, I was at the Fish annual meeting for a little bit. And I got out of there to go to the Alcona Market meeting and the Spring Lake Township meetings. Pretty quiet at both those places. On the 11th, the scale meeting with the first stop shop. They did a nice presentation. Also, just as of note, I sat by some two ladies from the Roseville area that were invited down. They wanted to see what the meetings were like, and they actually were very impressed with what was going on there. They, in Ramsey County, they don't have anything at all similar to scale. So I think they're going to work on creating something like that. So that is my report, Madam Chair.
Thank you. Commissioner Beer.
Thank you. And Deb, before we process these, we need to verify these dates. I've had some calendaring concerns. We think we're onward and upward. Anyway, on the first, had a monthly administrator meeting with Leslie, always a good time and great conversation. On the third, sat in on justice steering. That was an informative one. We might be having to do some horse trading here towards the end of the year for committee assignments. No. On the 8th, I swooped in for the tail end of the Prior Lake Spring Lake watershed meeting. Just wanting to make sure that if there's anything they need from us, that we're ready and willing and usually able. The 9th, post-secondary meeting. That is, it's a good group. There's a lot of dialogue. There's, different cities are looking at different things. It's just, which is a great, that's kind of the glue of sorts that's keeping things moving and maybe not necessarily completely together, but for positive reasons. But it's super informative. It's walking down the path. Also that afternoon, I was able to get over to the Workforce Center for lunch. Got to experience the joys of their HVAC system. The 10th, Fish annual meeting where Teen Challenge had a really, really compelling presentation at the end. Super compelling, and I sure hope we're open to doing more work with those guys. And with that, that completes my report.
Thank you.
Thank you.
Commissioner Beard.
Thank you, Madam Chair. On the 2nd of October, I attended as your representative to the Transportation Alliance, their annual legislative board meeting over in Lake Elmo, where we had some blunt discussion among the members, most of whom are roads and bridges people this time. That's a switch. And about the whether we should fight for a huge gas tax increase or actually work with the people as they exist today politically to get something done, and what is that something? It was a measured and one of the more reasonable discussions I've had with on that board, so it was pretty cool. On the 7th, the Spirit of Scott had a series of luncheons. I was able to go out to the Public Works and enjoy lunch with the folks who are going to be really important here in another couple months driving snowplows, so be nice to those guys. On the 8th, I was actually being able to serve lunch at the Spirit of Scott luncheon over next door at the Legislative or Law Enforcement Center, the LEC. On the 8th that evening, I also attended the CAP Agency Board meeting, and I think I mentioned last time they've got the, because of what happened before, we already had a program, an emergency program in place on how the governance leadership is going to take place in the absence of one executive director. And they also shared that they're going to do the executive director search internally, since our HR director that was recently hired about 6-7 months ago actually came from the executive recruitment field and is very good at what he does. So I'm grateful for that. That's where we are there. On the 9th, attended the MICA board meeting. And then on the 9th also, that morning before the MICA board meeting, I had a meeting with 3 folks from the Beacon Interfaith Housing Alliance to talk about possibilities of doing some emergency or low-income type of housing for homeless people here in Scott County. On the 10th, the House Bonding Committee made a stop in Shakopee, and I was asked to attend. Stopped by Turtles in Huber Park, where we talked about DNR trail connections in Memorial Park, and also the Carver Railroad roadbed, repairing that and actually connecting to the Carver County trails. We also talked about money for an open library program that we've discussed in workshop, I think, here on the board. On the 14th, had breakfast with 2 of our county leadership team, Jake Grussing for breakfast to talk about library issues, and then with the administrator at lunch just to stay in the loop on how things are going and talk about issues that pertain to Scott County. Madam Chair, that's my report.
Thank you. Commissioner Ulrich.
On the 2nd, I had the same meeting with the Beacon Interfaith group. They're interested in homeless housing for homeless people. On the 3rd, the Fish Executive Committee. The 8th, my monthly meeting with the administrator. The 9th, MICA. The 10th, my regular meeting with Savage and their administrator. And that same day, the Fish annual meeting, which has been referred to with the Teen Challenge program, and then the 11th scale. Actually, the group, the 2 that came from Roseville represent a group that we're going to go to in about a week to present scale and what scale is all about. So we encourage them. I think that's gonna be the model in the future. If somebody's interested in scale, let's really test their interest by first having them come to us, see it firsthand, and then we'll come to them and present. And that's why they were there. And so that's into my report.
All right, thank you. I've been out of town and returned last night, missed Scott County, so it's good to be home. So my report consists of, before today's meeting, I met with Health and Human Services Director Pam Selvig for our monthly update meeting.
Thank you for those
Wait a
email
minute, we need
requests.
more of a report from the walk. The walk.
That's later. All right.
You don't want to talk about that.
Nah. All right. County Administrator, do you have
I
any
have
items for us?
nothing further to add.
All right, thank you. And let's turn to our county attorney. Do we have any need to recess for a meeting?
We do not, Madam Chair.
Wonderful, thank you. Before we adjourn, just an announcement that we will be meeting in workshop setting after this meeting to discuss 3 items: proposed employee relations policy updates, executed new building construction contracts, and the mural for the government center construction project. So, seeing no further action to come before the board.
Motion to adjourn. Second.
It's been moved and seconded to adjourn. Any further discussion?
Discussion.
All in favor, please say aye.
Aye.
All opposed, same sign. Motion carried.
Sure got a lot of email updates.
I know, I will.